And I'm going to have Peter Zanoni come up and give the statistics of where we're going. I know all of us are concerned that we're on the downhill slide, but it doesn't seem to be going real fast. But at least we're on the downhill slide, so that's encouraging. But again, just as I know you get tired of this, but hang in there, continue to do what you're doing, wearing your masks, and washing your hands, and staying away from sick people if you're well, and if you're sick, stay away from well people. So I'd like to call on City Manager Zanoni to come at this time. Following City Manager Annette Rodriguez will come and to give us the information she has, and I believe Judge Canales will join us by WebEx or some video conference. So we'll get started, and City Manager, if you'll come.
Buenas tardes, iniciamos nuestra información diaria del COVID-19, vamos progresando pero lentamente. Continúen haciendo lo que están haciendo, el gerente de la ciudad les entregará los números.
How you doing? All right, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. I'm going to provide you the daily statistics of number of new cases and talk to you about the change in hospitalization as well as recoveries and then number of deaths as well. And I'm also just going to give you a quick update for those that were watching yesterday on Facebook. We were chatting about the police, our police department doing inspections of restaurants to make sure persons are in compliance. And this is something that the governor has talked about, where he has allowed cities to, or he has put orders in place, but expects cities to enforce some of the rules. And so we want to talk to you about how we're going to do that, or how we have been doing it, and how we're going to continue to do it to make sure orders are being followed, and ultimately then cases would start coming down. Okay, so before we do that though, let's talk about the cases. So this graph here will show us, for persons that can see this live as opposed to hearing it on the radio. Today we're reporting 231 additional new COVID cases for Nueces County. And some good and bad news. It's still kind of a high number, right? We have to aim for and hope for those days when we have 0 new cases or lower single-digit numbers, as was the case several months ago. So the good news is it's less than yesterday. Yesterday we had 259 new cases. And so today's 231 is 28 cases fewer. It's also fewer than Thursday a week ago, where we had 324 cases on the 30th of July. And it is right at the 7-day average. The 7-day average number of new cases is 230, so just slightly above at 231. And that's one of the first times in several days where the 7-day average is where the daily average is, which is good. Over the past couple of weeks, really, the daily average has been much greater than the 7-day. Okay, so that's that. So 231 new cases for today. When we look at the graph that talks about recovered versus active, so the orange slice here that you can see is what we want to see more of on this graph. And up until now, it's really only been about 10, 12, 25%. Or less, really, but the last couple of days we've had a lot of persons move to the recovered status, and today's 6,100 persons that are in the recovered status has increased by 450 people just since yesterday. So we have 46% then of all the cases are in a recovered status, and then 54% are still active. And this split is something we saw before that big spike hit recently. So this is some good news. We want more persons recovered than active, and but in that active case category, there's still quite a few persons, 7,222. And then the deaths have increased by 10 since yesterday, so we're showing 227 deaths since the beginning of reporting, and we'll go over that in a little bit more detail in a moment. When we look at hospitalizations, this is slowly coming down. You can see on this graph, the high was 430 about 2 weeks ago. Today we're at 306, so about 114, 124, I mean, or what is it, 124 fewer than about 2 weeks ago. But 306 in the hospital today, that's 20 less than yesterday. So that's another good trend there, 20 fewer from yesterday. When we look at the next chart, of those 306 that are in the hospital, 126 are in intensive care, meaning their case is more severe and they need more intervention, more help. That number, the 126 persons in ICU, is 6 fewer than yesterday. So yesterday there was 132 in ICU. Today with the 126, it's 6 fewer people. And then let's talk about deaths a little bit more. I had mentioned that there are 10 additional deaths, unfortunately, over yesterday's number. And so yesterday we had 217 reported deaths. With today's 10 additional, that brings us to a total of 227 deaths. And we've been talking some pretty significant numbers over the last 7 days, and we went back to look on what does this mean. And so over the last 7 days, we've had a total of 61 deaths in that last week. And that is 25% of all the deaths are just in the past week, the past 7 days. Each of those days had a significant number, 10s and 9s and 8s, and a few numbers higher than 10. So we need that trend to reverse as well. Okay, and then the final graph here shows us our daily count as well as the running 7-day average. And you can see here that our 7-day average line is slowly coming down. It is descending on these last couple of days. It kind of descended, went back up about a week ago, but it's slowly coming back down, just as the Texas A&M Corpus Christi scientists said that it would do. It's a slow descend. The 7-day average case is 230 cases every day. That's based on the last 7 days average. Okay, so that concludes the stats for the day. Let me just spend a few minutes talking about our police work that we're going to do on restaurant compliance. And so the governor has given us orders given the business community orders that occupancy in a restaurant shouldn't be any more than 50% of their rated capacity. It doesn't mean 50% of the seats that they have, but 50% of the fire rating occupancy number that they're given when they get their certificate of occupancy to open the restaurant. And we've saw several chats on Facebook yesterday, and we've heard too over the last couple of weeks, really, since that order has been put in place, that some of the restaurants may not be following that to the optimal level, meaning they have more patrons than 50%. So one thing to let folks know is our police department, led by Chief Markle, for several weeks have been doing some type of surveillance. And it's mostly been, though, those restaurants that have a bar component in them as well. And so they have been monitoring those and going in as part of their normal duties. That is, if it's a restaurant with a combined bar. But after the mayor and I have spoken with them since yesterday, they're going to put together a new operational plan, which will continue to focus on the bar restaurant facilities, but also independent restaurants. And they're going to put into their operational plan for all police officers to go into restaurants that are more lunchtime, dinner type standalone establishments, and so probably through lunch till about 10 p.m. and just work with the restaurants to make sure they stay in compliance. The goal is not to ticket and fine and come down hard on, but rather work, as our police department does a great job at already today, work in a community-oriented fashion to help some of these restaurants get into compliance. The order helps to reduce, the amount of persons that one can come in contact in a restaurant, so that 50% or less occupancy. The goal is to minimize the amount of droplets that express from each individual and keep the restaurant safe for those people that are there. Okay, so we heard you loud and clear yesterday, and we've acted on it. It's kind of the bottom line, and we'll have a more detailed operational plan by tomorrow, and that we can share with the community. And then we can report out over time how things are looking, how many restaurants that we've gone into, who are in compliance, and then where do we have to make adjustments with some of them. Okay, so that takes care of that. We're going to get this translated into Spanish, and then I think, Annette, are you coming up next? Okay, and then Annette Rodriguez will be coming up next. Thank you.
En las últimas 24 horas se han reportado 231 casos confirmados por el coronavirus. 6.103 pacientes se han recuperado por completo, 306 continúan en el hospital. 126 están en la unidad de cuidados intensivos. Hoy se reportan 10 fallecimientos a la fecha. Los fallecimientos totalizan 227 personas. Fallecieron 10 personas más y en los últimos 7 días han habido un total de 61 personas fallecidas. Necesitamos que esta tendencia empiece a bajar. El Departamento de Policía estará asegurándose que los restaurantes estén operando a una capacidad del 50%. Nuestra meta no es andar multando a los restaurantes, sino confirmar que se siguen las reglas.
Annette Rodriguez, Public Health Director. I have my 6-foot distancing stick here, so in case we need to measure anything. So the Health District's next drive-through will be tomorrow morning at 6:30 in the morning, and you're welcome to call the 826-7200 to make an appointment if you are symptomatic for COVID-19 and would like to get tested. We continue to see COVID deaths reported daily. Today we had 10. Our condolences do go out to their family and friends of the deceased. While COVID-19 cases have definitely declined compared to previous weeks, I must remind everybody, do not let your guard down. Do not take a break from COVID-19. Our numbers continue to stay around 250 every day of positive cases. Today we had 231. Those cases equate to approximately 2,500 people that we placed in quarantine that are waiting the 14-day incubation period to see if they too will become positive. These 2,500 people that are in quarantine, they're there because each positive case may only have close contact with 10 other people during the time they were ill. Those close contacts may be family members, co-workers, or even just close friends that they were with. So the 250 times the 10 contacts for each positive equals 2,500 additional people every day being placed in quarantine. Let's be perfectly clear. These numbers, 250 cases or 231 today, and the additional 2,300 people in quarantine every day is still way too high for any of us to think we are safe from getting COVID-19. What I will say is that the further away from March that we get, that was the beginning of the pandemic for us, the higher our chances of surviving this virus. The reason I say that is the further from March we get, the closer we're getting to a COVID-19 vaccine. The more knowledge we have gained about the virus, and the more treatments that we have that are available to treat COVID-19 patients. We also know that the healthier we can become, the higher our chances are that we will survive COVID-19. We have learned that this virus targets people that are vulnerable, elderly, with comorbidities, overweight, and sometimes will even affect a perfectly healthy individual, but not near as often as it will negatively affect those that have the underlying medical conditions. So here is some advice. Stay as far away from the virus as possible. If you never get exposed to COVID-19, you will never get the virus. So here's what public health professionals are preparing for. With fall around the corner and back to in-school face-to-face instruction and flu season quickly approaching, this is the perfect storm where we all need to be ready for the second wave. That second wave may actually be worse than the first wave. We pray we're wrong, but just like we prepare for an impending hurricane, we too must also heed the warnings and prepare accordingly for the second wave of COVID-19. In preparations for a storm, we board up our homes, we use sandbags to keep water from coming inside, we cover our prized possessions, and many times we pack our things to find a safer location to ride out the storm. Here are some really important tips to be ready for COVID-19 round 2. These are tips we are giving our family members, so of course we're going to share them with our community as well. First, and I think everybody knows this, stay as healthy as possible. That goes without being said, but I'm still going to say it. So stay as healthy as possible. Okay, then we have vitamins, and you don't have to write these down because they're on our website. But the vitamins are vitamin C, 500 to 1,000 milligrams twice a day, quercetin, 250 to 500 milligrams twice a day, and this vitamin can be found in kale or red onions. Zinc, 75 to 100 milligrams per day. This might cause an upset stomach, so you can decrease the dose if that happens. Melatonin, it's a slow release. Begin with 0.3 milligrams and increase as tolerated to 2 milligrams at night. Vitamin D3, 1,000 to 4,000 units a day. And also something we all know as Pepsid, 20 to 4 milligrams a day to keep acid reflux down. The other thing is if you are currently on a low-dose aspirin, you already take a low-dose 81 milligrams of aspirin every night, talk to your doctor about increasing the dose to 324 milligrams. That's 4 of those pills for a 14-day time period. Then resume your regular dose. Or ask your physician if he or she thinks it might be helpful to place you on a blood thinner. We know now that COVID-19 causes blood clots. So being on a low-dose blood thinner may be helpful in the event that you do get the virus. Get some exercise in, take a walk or a bike ride, go around the block. It's good for your mental health, and it's also great for your physical health. You may also want to invest in a pulse oximeter, sometimes referred to as a pulse ox for yourself, and also buy one for family members that don't live with you. A pulse ox is a machine that you place on your index finger, and it gives you a precise measurement of oxygen levels in the blood. You can buy them on Amazon or online or at a local pharmacy. They're around $20 each. If you start to feel like you're getting symptoms of COVID-19, shortness of breath, upper respiratory type infections, loss of sense of taste or smell, headaches, or you feel like you might have a sinus infection, start checking your pulse ox. You want the readings to be about 95%, up to 100%, which is the best. If it starts to drop below 95%, you need to speak to your doctor, or you can call the health department if you're needing more information. If you are experiencing shortness of breath, this is a really good time and a piece of equipment for you to have in your home. If you already have lung problems like COPD, chronic obstructive pulmonary disease, or emphysema, you may already deal with low pulse ox readings because of these other conditions. So again, please speak with your physician. Practice deep breathing exercises. Keep your lungs as active and healthy as possible. Get your flu shot this flu season. Even if you've never gotten it before, talk to your doctor about making this the year to get vaccinated against the flu. Flu season runs from October through May of 2021. The CDC recommends that everybody 6 months of age get a flu vaccine. So many of us heard the summer months with high heat temperatures and high humidity would dampen the ill effects of COVID-19 in our community. Those two factors, extreme heat and humidity, were supposed to keep COVID-19 at bay. We know the respiratory virus, COVID-19, doesn't care what temperature it is. Our highest number of cases were in our hottest months. In June, we had approximately 2,200 cases, and in July, we had over 9,900 cases. The reason I bring up the second wave is not to scare anyone, but to prepare you, hopefully arm you with everything we have to be safe during this coming flu season. The flu symptoms are the same as the COVID-19 symptoms, which makes it difficult to figure out which virus you may have. And our hospitals will once again be inundated with COVID-19 cases. That's why we're asking, again, everyone 6 months and older to get vaccinated against the seasonal flu. While we do not have a vaccine currently for COVID-19, we do have a vaccine for seasonal flu. And while it doesn't always cover 100% of the possible flu strains out there, we believe that some coverage for flu is better than no coverage at all. If you do become symptomatic for COVID-19 during the flu season and you've had your flu shot, your physician may only have to rule out COVID-19 and not both flu and COVID-19 virus. The other concern we have during flu season is that the weather starts to get colder. And as it gets colder, people naturally tend to migrate inside. If someone is sick in your household and everyone is indoors due to the cold temperatures outside, more people will be sick. In summary, if you get sick, do your best to get over the virus at home. Take your vitamins, drink your orange juice, stay hydrated, check your pulse ox, isolate yourself from others, stay home, and do everything in your power to recover fully. Of course, if you feel you are getting worse, do not hesitate to get the medical attention you need. Let's all start working together toward a healthier lifestyle to combat COVID-19 together. We are almost to the finish line. If we can get to the spring, I will promise you that we will see better days ahead. We may have COVID-19 around forever, but by the spring, we will know how to live with it, like we do for seasonal flu and other viruses. So don't give up the fight just yet. Wash your hands often. Wear a mask when you leave home. Social distance at least 6 feet from strangers. Don't touch your eyes, nose, and mouth with dirty hands. And disinfect frequently touched objects so that we can all get through this flu season and get vaccinated against COVID-19 when the vaccine is available. Stay strong. We're almost there. Stay united, and as always, stay informed. Visit www.cctexas.com/coronavirus for a list of the vitamins and tips on how to keep us all a little healthier this flu season. We'll now have the Spanish translation, and then we'll have County Judge Canales. Thank you.
El próximo puesto de tomas de muestras móvil será mañana desde las 6:30 de la mañana. Si tiene síntomas de COVID-19, llame al 361-826-7200 para programar su cita. Continuamos viendo muertes del COVID reportadas diariamente. Hoy tuvimos 10. Nuestro más sentido pésame para las familias y amigos de los fallecidos. Nuestras cifras siguen siendo alrededor de 250 casos positivos de COVID-19 por día. Estos 250 casos equivalen aproximadamente a 2.500 personas puestas en cuarentena, esperando el periodo de incubación de 14 días, para ver si también se vuelven positivas. Estas 2.500 personas están en cuarentenas asumiendo que cada caso positivo solo tuvo contacto cercano con 10 personas. Esos contactos cercanos pueden ser miembros de la familia, compañeros de trabajo e incluso amigos cercanos. Hemos aprendido que este virus se dirige a personas vulnerables de edad avanzada con condiciones preexistentes, con sobrepeso y a veces incluso afectará a personas perfectamente sanas, pero no con tanta frecuencia como afectará negativamente a aquellos que tienen problemas médicos. Así, aquí hay algunos consejos. Manténgase lo más alejado posible de este virus. Si nunca se expone al COVID-19, nunca lo recibirá. Para eso es que nos estamos preparando los profesionales de salud pública. El otoño se aproxima y también el regreso a la escuela con instrucción cara a cara y la temporada de gripa se acerca rápidamente. Esta es la tormenta perfecta donde todos necesitamos estar listos para una segunda ola. Aquí hay algunos consejos realmente importantes para estar preparado para la ronda 2 del COVID-19. Manténgase lo más saludable posible, tome vitamina C, tome quercetina, tome zinc, tome melatonina, vitamina D3 y opción de famotidina. Todo esto está en nuestra página web. Si actualmente está tomando una dosis baja de aspirina, hable con su médico acerca de aumentar la dosis. Es posible que desee invertir en un oxímetro de pulso. Es una máquina que se coloca en el dedo índice y le brinda una medición precisa de los niveles de oxígeno. Practique ejercicios de respiración profunda, mantenga sus pulmones lo más activos. Les recomendamos que se vacunen para la gripa. La temporada de gripa es de octubre del 2020 y el 2021. Por favor, continúen con las medidas preventivas.
Thank you, Barbara Canales, Nueces County Judge. I want to reiterate something that I always try to remember, and that is to give thanks to our City County Health Department. That was a terrific presentation. And I don't know about you guys, but I feel empowered now, because now I know if I take that good advice, I can do something about coronavirus in my own personal world. And so I'm going to heed that advice, and I'm going to ask that all of you do the same. Stay healthy to the extent that you can. And I've focused my presentation today on another thing that we can do if we find ourselves in a particular predicament. So today I want to talk to you and written some notes about the importance and availability of testing in our community. You know, sometimes we get so focused on the data or whatever the particular news of the day is, and we forget that it all starts with testing. And so I wanted to reiterate, why is testing so important? Well, here's the bottom line. Testing lets you know whether or not you have the virus, right? And testing lets the United States and Texas and this county know what the virus is doing in our community and what we need to do to contain it. So I want to talk about the benefits to you. The sooner you know you have the virus, obviously, the sooner we're all going to take it more seriously if it's you that have tested positive. So, and I understand there are situations where people say, I don't want to get tested. People just don't want this virus. I'm no different. And they don't want to think that they have it. And I can't tell you the number of people I've spoken to who have tested positive, and they have said, you know, I had no symptoms. I had no idea that I had coronavirus. And the reason is because we dismiss sometimes the obvious. That little cough, we say, oh, that's allergies. I was working in a dusty room, and that's why I'm coughing. And I didn't think it was so bad because, you know, everybody coughs. And fever, oh, it's just a summer cold. And pretty much everybody has that once in a while, a little bit of fever. I'm sure it's not COVID. And so we dismiss yet another symptom. Or what about when we feel run down or we feel fatigued? We're always going to have an excuse for, well, we've had a busy day. So there's going to be some bit of avoidance in not getting tested. And some people just don't want to find out at all. And I understand that as well. But I don't want people to fear that there is some sort of stigma because they have COVID. Because getting COVID is not a sign of weakness. And it's not a sign that you've done anything wrong. I want to repeat that. If you get COVID, it is not a sign necessarily of anything you've done wrong. Now, of course, there are ways to get COVID from doing all the wrong things. But I want to talk about the opposite today. We are dealing with a highly infectious respiratory virus. And it is possible to do everything right and do something very necessary and mundane and still get this virus. We know that. But I suspect that many who aren't getting tested are doing so because they also think they maybe have a civic duty. And let me tell you what I mean. There's a bunch of good people out there that are tough and strong Texans. And tough and strong Texans don't really think their symptoms are that bad, and they want to save that test for someone who really needs it. How many times have you heard that? I'm not going to get tested because I'm not really that bad, and I really want to save that test for somebody who's really sick and who really needs it. Well, this county judge wants to say that I appreciate your toughness, and I think I can be tough too, but if you have any reason at all to suspect that you might have coronavirus, COVID-19, or if you think you've been around anybody that tested positive, I want to encourage you, whether you think you have a small exposure or a large one, to get tested. We were all going to be better off if we know who has this virus and who doesn't. And the sooner you get tested, the sooner we can help you here in Nueces County. And the most important thing we can do is help you understand how this disease might impact you, because everybody's got a unique set of conditions that could impact the course of this disease. And Director Rodriguez went over that laundry list of conditions, medical health conditions, that could impact you if you have this disease. And conditions that you've lived with and you've managed perfectly for years, like diabetes or heart disease or even high blood pressure, all those conditions can take COVID to a different level. It can even take it to a deadly level. And so we want to help you understand your risks. And if you need to get tested, the sooner you do is the sooner we can create an effective intervention for all of you who test positive for the coronavirus. And just like that pulse oximeter that fits on your finger was described today, we'll be able to teach you how to monitor your health so you can spot the signs of something getting worse. The earlier we get you to treatment, obviously the better outcome you will have. And I want you to know that if you don't have symptoms, you can still get tested. And in fact, the whole purpose of me talking about testing is leading up to this big moment. Okay, so here it is. The big moment is this, and I'm really proud of this because Nueces County has really taken a large lead in this. And that is that we have free testing. Besides the great testing that's done at the health department, we have free testing that's performed by a private company called Dalco. And this company has a particular contract with the state of Texas, and through the Texas Department of Emergency Management, which I'm a part of, they are going to be here at American Bank Center through Saturday, August the 8th, from 8 a.m. till 2 p.m. American Bank Center up until Saturday, 8 a.m. to 2 p.m. Now, let me give you the best part. That was pretty good. This is the best part. They are performing the test using throat swabs, not the ones that go up the nose, and they are typically quick results, and they are available in 1 to 5 days. And if your email is provided, you can usually get your results through email back in 2 days. And just so in case you're interested, these swabs are taken to San Antonio for very quick results. And we really have great capacity to test hundreds and hundreds of people. And here's also another good point. Nobody is turned away. And a part that I really like is registration is on site. No advance appointment is required. And they will ask you if you have symptoms, but I don't want you to worry if you don't have symptoms. You will not be turned away. So if you need a test this week, there are many ways to test. Your health department is an amazing place to test. And it's where I got tested, and they did an amazing job. And they are so efficient, and you get results very, very quickly. But we have to offer all kinds of opportunities for folks. And if you're not prepared, but you wake up that morning and you worried, you can go to the American Bank Center through Saturday, August 8th. And by the way, I'm already working on new dates for next week, but I'd like to hold off on that. Right now, I want to tell you that you can go tomorrow or you can go on Saturday from 8 a.m. to 2 p.m. No appointment required, okay? And that is free testing. It's first come, first serve, and it's open to all Nueces County residents. So I'm very proud of these activities that we have a tremendous role in playing from our city's perspective through law enforcement. CCPD, my hat is always off to you. and our county, who helped set up all of the logistics to make this testing possible. And I just want you to know that, there's a lot of heroes out there. And we've seen so many acts of heroism in this pandemic, and people who bravely go to work, who have essential jobs, who are in critical infrastructure, and those first responders who have to keep the peace and make certain that we keep our healthcare workers also in our minds as first responders. There's also amazing people that are in the grocery stores and at the gas stations and at the pharmacies. So my hat's off to all of you, and to you teachers who are getting prepared to endeavor in education in a whole new way. Today, my hat goes off to you. And we are actively going to do everything in our county to stay proactive, because we know that what Ms. Rodriguez has told us is true, that a second wave is sure to come, and we must prepare now. And that's every day that we are dedicated to this mission. And so all who have risen to the occasion, to doing all things that they need to do to keep us safe, particularly sometimes an everyday neighbor or friend can be a hero. I want you to know all of those people are heroes, but there is no heroism at all in not getting tested. In fact, just the opposite. You can protect your community, your neighborhood, your colleagues at work if you suspect anything, to go and get tested. If you have mild symptoms, go get this test. I'm just giving you the easiest way to get it. First come, first serve at the American Bank Center for the next 2 days, and we'll set up more times next week. And I really want you to know that if you get that negative result, and even if you had no symptoms, I know you'll sleep better. So if you get that positive result, I want you to know that we're prepared here to help. We're prepared to lead you with education, with information, to taking the actions that we hope will save your life and of all those around you. And I know that when we have more people tested, we will have more solid data. And more data is more information. And information is not just knowledge, it's power. It's power to make good decisions. You have heard me say this a million times. Data drives the decisions we make as electeds, and in particular in this scene of emergency management. And so the more data we get, the more we can understand what's happening in our community. Finally, let me give my last set of praise to the gracious donors who made it possible that your bus benches all over town and your buses all over town have incredible PSA, public service announcement messaging about mask wearing. And particularly, thank you to Bill Pettis and Pettis Advertising for doing an amazing job in creating those graphics, to Al Jones and company for creating the opportunity to gather as fellow businessmen and women who understand that a healthy community is also a economically prosperous community. So thank you for decorating our community with the right message for the right time. I stand by to answer any questions you might have. Thank you.
Muchas gracias a las recomendaciones de nuestro Departamento de Salud Pública. Es muy importante hacerse el test. A veces pensamos que es mejor darle la oportunidad a alguien que lo necesite realmente, pero es muy importante que todos nos hagamos los tests para estar mejor preparados. El sábado 8 de agosto, desde las 8 de la mañana, tendremos un sitio de test gratis móvil en el American Bank Center. El registro es allí mismo en el American Bank Center y le darán los resultados por email. Este test es gratis, como dije. Así que mañana con el Departamento de Salud Pública o el sábado con el American Bank Center. Si los resultados son positivos, aquí estamos nosotros para ayudarlos. Esta información nos ayuda a todos a prepararnos mejor.
Okay, well, that concludes the presentations. Mr. Zanoni had a conference call at 5:30, so he had to step out, but the judge is here through WebEx, and Annette is here if you have any questions, or I'm here if you have any questions. For Annette? Okay.
That earlier in the month we had, talking about the baby situation, 80 tested. Where are we at with that situation now? How's that going?
So yes, earlier in the month of July, we did have 85 babies under the age of 24 months, so 1-year-olds basically, that had tested positive for COVID-19. Since that time, I think that was July 13th when we actually looked at the data, right around that time, that number has doubled. So we're close to 164 babies now, the same age, that have COVID-19. We're seeing a lot of the cases in family units. And so when we call and ask, well, how do you think the baby got the virus? They'll tell us, oh, the grandma was positive, or the dad was positive, or the mother. And so we're seeing that. So we're, again, trying to remind them, the babies don't necessarily have to get COVID-19. If you can isolate, from the baby, and it's hard to do. Everybody wants to be close to the baby, but we don't want to get them sick. So it's really important to do your part if you have COVID-19 and there's an infant in the house, to do your part and not to get close to the baby, washing your hands often, but stay away from the baby as best you can. Stay opposite sides of the house, or better yet, if you don't live at the home, don't come to the home where a newborn is or somebody under the age of 1 year.
Now, are these babies from the Nueces County area, or are these babies being brought in from other cities?
These are just our babies. They have Nueces County addresses. These are only our babies.
Just Nueces County?
Just Nueces County. Yeah, I'm not counting San Pat's or, Jim Wells. I'm just counting Nueces. It's amazing.
What are the hospitals, or not just the hospitals, but officials like you, you're trying to get the word out. What other things can parents do you've already explained that, but.
Yes, so some of the things that parents can do, and that's a great question, is, again, if you're sick, stay away from, small children, especially those under the age of 6 months, because they don't have their immunities all built up yet. That's why even for flu vaccine, we don't vaccinate anybody under 6 months, only 6 months and older. So it's really important if you're sick not to be around the baby. So the other thing is, if there's nobody sick in the household, don't be taking the baby out. And sometimes people we've talked to say, well, we're single parents and we have to go out. We have to go get formula. We have to go get diapers. So we have to take the baby with us. Makes sense. You have to take the baby. Then put them in a stroller and keep them covered. We always see during the wintertime they cover them. There's a blanket over them. They need to make sure that they do the same types of things. They can't get too hot, but that they need to be covered appropriately so that somebody passing by doesn't accidentally cough and get that on the baby's eyes, nose, or mouth. So keep the baby covered if possible.
Do you know how many of those babies are on incubators, or,
So,
how sick are they?
well, the first 85 that we looked at, 9 of them were hospitalized of the 85, and so none of them were in ICU, and so that's a really, good news. Again, we did lose a baby early on, and so we know that we lost one of those 85 infants. So for the second half of these infants, I do not have those numbers. I have to remind people that we're not trying to focus on the statistics as much as we all want to know those numbers. We have to remember that our focus is currently to isolate any positives and to isolate any contacts so that we can stop the spread of the COVID-19.
Any other questions? All right, well, I want to thank you for joining us today. Tomorrow will be at 5 o'clock, and that's Friday, and that will be when Texas A&M is here, and then to give you their report and their projections, how we're doing and what it looks like, say, for the next week. And also, next week, we will have the meetings only 2 days a week, the briefings 2 days a week. We'll continue to put out the numbers on a daily basis, but in terms of having a briefing, that we're starting to meet on Tuesdays and on Fridays. And on Fridays, you'll have the A&M Corpus Christi presentation. So next week, we'll have Tuesday and Friday, but on a daily basis, I'm sure they'll continue to put out the daily numbers so that you will have those. But as far as the briefing goes, Tuesday and Friday. If there's no other questions, then we'll see you tomorrow, and A&M Corpus Christi will be making their presentation. Thank you.